Assessment of the breast and regional lymphatics. Welcome to this educational video which focuses on breasts and regional lymphatics. In this video, we will cover the anatomy and physiology of breasts, changes related to pregnancy, performing a breast self-exam, and breast assessment techniques. Breast anatomy. The breasts are composed of glandular tissue, fat, and ligaments. The glandular tissue is responsible for producing milk during lactation. The breast tissue extends into the axilla or armpit as the axillary tail of spence. The axillary tail of spence. The axillary tail of spence is a small extension of breast tissue that extends into the axilla. It is important to include this area in the breast exam, as it can be a common site for breast cancer. The regional lymphatic system. The lymphatic system is a network of vessels and lymph nodes that help to fight infection and remove waste from the body. The lymphatic vessels in the breast drain into the axillary lymph nodes, which are located in the armpit. There are several regional lymph nodes in the axillary region, including the central, pectoral, lateral, subscapular, and apical nodes. These lymph nodes are important for detecting and diagnosing breast cancer, as cancer cells can spread through the lymphatic system. During a breast exam, the clinician will also palpate the axillary lymph nodes to check for any enlargement or tenderness, which can be a sign of infection or cancer. Breast assessment. Now let's dive into the objective assessment of the breast. This includes inspection and palpation. Breast assessment is an important part of the physical exam for women. It involves a visual inspection and palpation of the breasts and axillary lymph nodes. During a breast exam, the clinician will look for changes in size, shape, and symmetry, as well as any skin changes such as dimpling, puckering, or redness. They will also feel for any lumps, masses, or areas of tenderness in each of the 4 quadrants. During inspection, the healthcare provider will visually assess the breast for any abnormalities such as changes in size or shape, skin changes, or nipple discharge. It is important to inspect the breast in a well-lit room with the patient in a comfortable position, with her arms relaxed at her sides and then raised above her head. The healthcare provider will then move on to palpation, which involves using the hands to feel for any lumps, masses, or other abnormalities in the breast tissue. Palpation can be performed using a variety of techniques, including the vertical strip, circular, or wedge method. The healthcare provider will typically use a combination of techniques to thoroughly examine the breast tissue. During palpation, the healthcare provider will also examine the axillary tail of spence and the regional lymph nodes, feeling for any signs of tenderness, swelling, or enlargement. Breast self-exam. It is recommended that women perform breast self-exams regularly, usually once a month. This involves looking at and feeling the breasts and axillary lymph nodes for any changes or abnormalities. Women should report any changes or concerns to their healthcare provider. Breast cancer. Breast cancer is one of the most common types of cancer in women. It can occur in any of the 4 quadrants of the breast, but it is most commonly found in the upper outer quadrant, as well as in the axillary tail of spence. Some common symptoms include a lump or mass in the breast, changes in the breast size or shape, nipple discharge or inversion, and skin changes on the breast. The American Cancer Society recommends that women with an average risk of breast cancer should begin screening mammograms at age 40 and continue yearly thereafter. However, it is important to note that the age to start breast cancer screening may vary based on an individual's risk factors and family history. It is important for women to discuss their individual risk factors and screening recommendations with their healthcare provider. Breast cancer may be spotted during a breast exam, mammography, or other imaging tests. Early detection and treatment are important for the best outcomes. Mastectomies and their impact on the breast and regional lymphatics. During a mastectomy, the healthcare provider may need to remove some or all of the axillary lymph nodes. This can affect the flow of lymphatic fluid and increase the risk of lymphedema, which is a condition that causes swelling in the arm or hand on the site of the surgery. It is important for women who have had a mastectomy to take special care of their affected arm and to take steps to reduce the risk of lymphedema. This may include avoiding activities that can cause strain or injury to the arm, wearing compression garments, and performing exercises to improve range of motion and strengthen the affected arm. Women who have had a mastectomy should also speak with their healthcare provider about any concerns they may have regarding lymphedema, and to report any signs of swelling or discomfort in the affected arm. In addition to breast cancer, there are other changes that can occur in the breasts. Pregnancy is one of the most common causes of breast changes in women. The breast during pregnancy. During pregnancy, the breasts undergo several changes to prepare for lactation. The glands in the breast enlarge and become more active, causing the breast to become fuller and tender. The areola, which is the darker area around the nipple, may also darken and enlarge. As pregnancy progresses, the breasts may continue to enlarge and become more sensitive. It is important for women to wear a properly fitting bra during pregnancy to provide support and prevent discomfort. It is also important for pregnant women to continue performing regular breast self-exams, as changes in the breast can still occur during pregnancy. Any new lumps or masses should be reported to a healthcare provider for further evaluation. After childbirth, the breasts continue to change as they begin producing milk for the baby. The areola may become even darker and larger, and small bumps called Montgomery's glands may become more prominent. It is important for women to continue to practice good breast hygiene during lactation to prevent infection and maintain milk production. This includes washing the nipples with warm water and avoiding the use of soap or other harsh products. Before we conclude, we want to briefly touch on some risk factors that may increase a woman's likelihood of developing breast cancer. Breast cancer risk factors. One of these risk factors is alcohol consumption. Studies have shown that alcohol has a dose-dependent effect, meaning the more alcohol a woman consumes, the higher her risk for developing breast cancer. On the other hand, physical exercise has been shown to help reduce the risk of developing breast cancer. Regular exercise can help maintain a healthy weight and lower levels of estrogen, which is a hormone that can contribute to the growth of breast cancer cells. Speaking of weight gain has also been linked to an increased risk of breast cancer. This is because fat cells produce estrogen, which can contribute to the growth of breast cancer cells. Finally, hormone replacement therapy, or HRT, has also been linked to an increased risk of breast cancer. Women who take HRT to manage symptoms of menopause should discuss the risks and benefits with their healthcare provider. That concludes our video on breast and regional lymphatics. We hope you found this information helpful and informative. Remember to perform regular breast self-exams and report any changes or concerns to your healthcare provider. Thank you for watching.